So you're going to have cataract surgery or LASIK surgery to help improve your vision. Well, first off, your doctor, your ophthalmologist is going to probably put you on a combination of eye drops. One will be a steroid to help reduce the swelling and to help in the healing process. The second one will be an actual antibiotic to help prevent infection. And the third one will be a non-steroidal anti-inflammatory drop. That one will also help as far as decreasing the swelling, and with the swelling some redness as well. Generally, you're going to start on at least 2 of these a couple of days prior to surgery. Some providers will want you to start all 3 2 days prior to surgery and then continue them on through for at least 2 weeks after surgery, and sometimes they'll have the steroid even longer than that, depending on what type of surgery and your provider's protocol for the surgery. So what we're looking at, first off, you'll have prednisolone. That is the steroid. With this one, you want to make sure that you shake it well before you put it in. Realize that when you use more than one eye drop, and I don't care what it is, but especially in this situation, you're going to want to separate them out by at least 5 minutes. If you can do a little longer, that's even better. The second one that you'll see is an antibiotic. And some providers will want moxifloxacin, some will want ofloxacin. There may be some other ones that providers use as well that might be a little cheaper, but these right now are pretty cheap as far as that goes. They're both fluoroquinolone, which is a long word for them, antibiotics. And again, they're used to help prevent the infection or an infection from occurring. And then the last one that they will have is a non-steroidal anti-inflammatory to decrease the inflammation and the swelling that can occur. And that one generally is going to be ketorolac. I've also seen them use diclofenac depending on what's available. Now with this one, it's very important, if your insurance does not cover it or if your copay is high, to talk to your pharmacist, because a lot of times the provider will write for 0.4% of the ketorolac. That is more expensive than the 0.5%, and there's very little difference. So if your insurance doesn't like it or it's too high a copay, ask your provider about the 0.5%. It's a lot more reasonable, shouldn't be an issue there. Another kicker on the non-steroidal, either diclofenac or ketorolac, and I can tell you this from personal experience, when you put this one in, it does burn. So just be prepared for that. And you will see a little blurriness in your vision after you use each one of these. Again, remember to separate them out by at least 5 minutes, but be ready on the non-steroidal, the diclofenac or the ketorolac, because that one will burn a little bit.